Epilepsy is a condition of the brain where what happens is there is a tendency to get recurrent seizures. So that is what epilepsy is. And it is quite common in our population. It is quite common, and especially in childhood. Regarding causes for epilepsy, well, there is no one particular cause that can lead to an individual having an epilepsy. There are multiple reasons. In majority of cases, I can say, you can say up to 70% of cases, the cause is unknown. In the remaining small percentage where we do find out what the causes are, they vary from genetics to structural problems of the brain to some past incident that has affected the brain. By past incident, I mean to say, like if a person had had a severe infection of the brain, or some major head injury affecting the brain, or a stroke in the brain. So these are the conditions which may predispose a person to have seizures. Apart from this, there are certain temporary causes like metabolic abnormalities. By metabolic abnormalities, we mean something like a low sodium level, a low blood sugar level, a high calcium level. So these are the temporary reasons for getting seizures. First of all, a seizure is mostly a clinical diagnosis. Like if, as a doctor, I have witnessed a seizure, then I will be able to diagnose that the person is having a fit, first of all. And then I need to go further to find out whether or not the patient has a repeated tendency to have a seizure, which means that the person has an epilepsy. Now, it is not often that a patient will come to me while having a seizure. That usually does not happen. What happens is the patient comes himself, or the patient comes with a family member or a friend who will describe an attack. So that is the most common scenario that we see. So in this case, the history of the attack, the description of the attack is very, very important, is very vital for us to get the diagnosis. We need it is very essential to have a description of what the person was having at that point of time. So it is always useful to have an eyewitness, to bring along the eyewitness for the consultation. Sometimes they come with video recordings, which actually are very valuable for us in getting the diagnosis, a video recording of the attack. Because many a times, an attack which appears like a seizure to the patient turns out to be something completely different. So that is why visualizing the event is so important in getting the diagnosis. So once we are suspecting that this is a seizure, we go about doing certain tests like an EEG, which is like a record of the brain's electrical activity. We do an EEG test, which is a non-invasive test. We put some electrodes on the head and make the person lie down for around 20 to 30 minutes, and then we record the electrical recording, and then we have an assessment of it. One is EEG, and we also usually get brain scans done, which can be a CT scan or an MRI brain. So these are the tests that we usually do. We may also do some blood tests if we suspect some other condition. So these are usually the tests which are used to diagnose epilepsy. Now, one thing I would like to mention here is that many a time, in many cases, the EEG and the MRI may all come to be normal, but that does not mean the person does not have epilepsy. So in that case, the diagnosis is purely on a clinical basis. In a patient who is not yet having, who does not have a well-controlled epilepsy, who may have a seizure at any point of time. So for such a person, they need to follow several precautions, like while at home, they need to avoid activities that will involve open fire, like cooking on an open fire unsupervised. So they need to avoid that. They need to avoid using electrical appliances which can get very hot. Uh, they need to avoid using heavy appliances which may fall and injure them if they're not handling them carefully. Apart from this, outdoors, they need to avoid swimming or taking part in water sports alone. Apart from that, they need to avoid driving. People are very frequent gym goers these days, so they need to avoid instruments which are heavy, which may fall on them. um, these are they need to avoid cycling on open roads. So these are the things that they should avoid on a daily basis in case their epilepsy is not well controlled. Each one of us should be aware of what to do as a first aid for a person having a seizure, which we may encounter such scenario at any point of our life, in any situation. So what we need to do is, first of all, once we see a person having a seizure, we need to make sure that we do not crowd around this person. We need to avoid overcrowding around this person. There needs to be open space. We need to ensure that the person is lying on a surface which is free of objects which can hurt them. Like, we need to remove hard and sharp objects, hard, sharp, and hot objects from around them. Any sources of fire, we need to move it from away from the patient. Apart from this, we need to try to gently roll over the patient to one side. If the patient is having very violent movements, then better not to try anything to move him or her. We just need to clear the surroundings to avoid him or her getting hurt. We should try to cushion the head. If there is a pillow or something available, then we use that. Or we can use some daily wear garment like a blanket, a jacket, anything we can use to try to cushion the head. If the person is wearing a tight collar or a tie or something, scarf around the neck, we need to, or a dupatta, we need to loosen it so that he or she can breathe. These are the things that we need to do. Now, there are some things which we should never do for a person who's having a seizure, and these are very important because many a times when patients come to me describing an attack, they say that these are the things we did, and it turns out that those were the things that they were not supposed to do in the first place. Like, we should never try to restrain or restrict their movement. Like, if the person is having a seizure like this, we should not try to restrain their movement. We should not try to put anything inside their mouth, like a finger or a spoon, or we should never try to put anything inside their mouth. We should not try to put water on them, water inside their mouth. We should not slap them, hit them, nothing. We should not do that. These are the things which we should not do when a patient is having a seizure. And another important thing is, we should try to time the event, because that is very important. When the person, after the event is over, after the attack is over, when he or she goes to the doctor, the timing is very important. The timing the event, and we should not leave the person alone till the attack is over, until that person has regained consciousness. So that we should do. So this is how we should take care of a person who's having a seizure in front of you. Epilepsy is quite a common condition, and in majority of cases, in 70% of cases, it is well controlled. It can be well controlled using medications like simple tablets and capsules. An epilepsy patient should not be treated as somebody who is very different from the rest of the society. Epilepsy should never be treated as a social stigma, because an epilepsy patient is as competent in performing all other activities that any other non-epileptic person can do, be it doing a job, be it leading a good and healthy family life, be it enjoying with friends and family. So an epilepsy patient should never be treated as somebody different from the general society. And as a responsible citizen of the country, each of us should have some basic idea on what to do if we see a person having a seizure, having an epilepsy attack, so that we can safeguard people around us and be safe ourselves.